Hey everyone, welcome to this video on your foot to pelvis connection. So I think throughout life, we're not taught how connected our body is. So I want to focus today on the foot to pelvis connection. Whatever's happening in the feet will also be happening in the pelvis. And then we can even go further and say whatever's happening in the pelvis will also be happening through the upper torso, actually even into the jaw. Okay, so for today's purpose, we're going to focus on the foot to pelvis connection. And so you can see I have my toe spacers on. And this is one of the ways that you can start to notice what's happening in your feet, what's happening in your toes. So when you show up for your practice, notice how your feet land. So a lot of times in my class at first, when people start coming, they show up on the mat as we do in life. And so often some of my students will have their feet angled out. And so what happens here is we externally rotate the leg bones in the hip socket, right? So when we externally rotate in the feet, if that same thing's happening in the pelvis, because it's connected, we're actually opening through the front of the pelvis, like kind of overextending through the front of the pelvis. Okay, so this can cause, pain or imbalance through the front of the pelvis. When the feet are like this and we're opening too much in the front of the pelvis, what do you think is happening in the back of the pelvis? So when we stand like this and the legs are internally rotating towards the back of the pelvis, we're actually compressing through the back of the pelvis. So we're shortening through the back of the pelvis, which can also lead to pain, compression, lack of movement, lack of mobility through the low back, and this can cause hip imbalance and pain. So instead, let's see if we come to standing with the outer edges of the feet so that they're in line and parallel if you're on a mat. If you're not, just think of the wall beside you so that they're parallel to that and running a little bit more front to back rather than on an angle. See how that feels. Take a few deep breaths. So I'm just taking a cleansing breath in through the nose, out of the mouth. So you might have noticed right away that there is pulling. You'll probably feel the fascia in your body tugging or pulling in areas that it's not used to being open. So bringing this awareness into your day, into your practice, can help the fascia to hydrate where it's pulling. Of course, always operating at a 70% or less effort. So we don't want to push. We don't want to push the body into alignment. We want to feel what feels like effortless ease. You might notice a little discomfort or pulling or tugging, but that's normal. For me, when I start to breathe and relax into the rooting and grounding of my feet, I often feel my sacrum adjust. So it's almost like it's a click or a movement of the bones or the ligaments in the sacrum. And then that allows my whole body to kind of feel more aligned. And so the same goes for the other way. If you're a person who shows up in life with the feet pointing inward, of course, you're internally rotating the leg bones in the pelvis. So we're compressing the front of the pelvis then. So it would be shortening and probably tight in the low pelvis or the low belly. And then you'd be widening as the leg bones open in the back of the pelvis. You'd be widening through the back of the pelvis, which could cause some instability, pain as well. So play with this. Bring it into your day. Remember to bring that element of effortless ease in. So you're putting some effort in, you're noticing there's an awareness. You're not pushing the body into a shape that you want it to be in, okay? So just allowing the body to gently, slowly invite it into alignment. And then listen and see how it feels. If it's feeling really horrible, then ease off. Go back to the way that you stand normally, and then just do a little bit less. Slowly train the body back into alignment. So I use this one when I'm standing washing dishes, when I am standing in line at the grocery store, when I'm chatting with some friends. I'm constantly thinking, or I have my awareness around how my feet are landing on the earth. And then because of that, how my pelvis is aligning. So I've been taught through my training, through my yoga therapy training, that whatever's happening in the feet is happening in the pelvis, and the knees are then going along for the ride. Your knee is a joint that doesn't take the first action. What's happening in the feet and pelvis is what's going to happen into the knees, if that makes sense. So they're just going along for the ride based on where the pelvis is at or where the feet are at. And so another way to think of this connection between the feet and the pelvis is to think of what we call in yoga pada bandha. And so this is a foot lock. And there's different ways you can do a foot lock. In most regular yoga classes, you might hear ground through the four corners of your feet. And so when we talk about the four corners of the feet, we're usually thinking big toe mound, pinky toe mound, and then both sides of the heel, okay? In all of my classes, I tend to get people to bring awareness not only to the four corners of their feet, but also to the rest of the toe mounds. So each toe has a knuckle that connects or doesn't connect to the earth. They're meant to ground and root down into the earth, each knuckle. So your toe mounds, if you hear me refer to that, it's here at the top of the foot. Then we also have our toe pads. So each toe has a pad of that toe that then connects or doesn't connect to the earth. So notice your toe mounds and notice your toe pads. When you're standing, do some of your toe pads float? Just naturally, I can feel as I showed up today on my mat, some of my toe pads on my right foot are floating a little bit. And that's okay, no judgment. We're just noticing, we're bringing awareness. And then noticing all of the toe mounds, each knuckle of each toe. You might shift your weight around to notice. And then see if you can allow each toe mound to ground down, to become heavier into the earth. And now see if what happens when you ground or lean the toe pads into the earth. Just gently. We don't need to crunch them or really try too hard or push. And then the next part of the foot we'll notice is the circle of the heel. So you want to think of your heel as, I sometimes think of it as a target, like a bullseye. And we want to beam the circle of the heel down into the earth as well. So toe pads, toe mounds, and circle of the heel are all rooting down into the earth. And as we root down, sometimes we naturally, as anything in life, there's opposition. So sometimes as the energy moves down, there's a natural rebound of energy lifting up that you might notice. Sometimes it's not noticeable, so we have to bring the awareness to it. So as we root down, there's a rebound of the inner arches of the foot lifting up. So this is one way to do a pada bandha or a footlock. And then notice when you're doing that footlock, can you feel a translation not only through the inner arches, the energy is moving up, but also through the inner thighs into the pelvis. Maybe you can feel a little bit of action happening through the back of the pelvis, back of the legs. So the more you kind of root down with that rebound of energy up, you might feel some activity happening through the legs, the knees, and then we're moving that energy into the pelvis, that awareness. And don't forget to ease off. Sometimes we can get so stuck in the figuring it out or really wanting to get there that we forget to just enjoy the moment and be present. Find ease. Good, so you can let that go. Sometimes when we're first working with this, we can start to feel the tension build a little bit in the legs. So I like to use a palm tree, just letting the arms swing passively. Cleansing breath in through the nose, out of the mouth. And then I'm going to show you another option for pada bandha, for another footlock. And so this one, we can think of rooting down 25% effort into the big toe mound. So you're sending 25% of your energy or your effort down into the earth through the big toe mound. Now take the other 75% of that effort or energy and send it from the outer ankles out to the sides of your mat. So 25% through the big toe mound, 75% pressing out through the outer edges of the ankles or the heels. 25 and 75. Breathe in through the nose, out of the nose, deep breaths. And you might feel that more through the back of the hips, the glutes, these big muscles here that are meant to support us and keep our pelvis stable, our hip joints stable. So let that go. Take a cleansing breath in through the nose, out of the mouth. Now let's try 50-50. So 50% down through the big toe mound. 50% out of the outer heels. What's happening with the inner arches? Are they lifting? Are they getting flatter? Is this a better version than the other version for you? We want the inner arches to lift. We want them to be a dome. we still want to root through all of the places in the foot that we talked about. 50-50, noticing the difference between what's happening in the legs and the pelvis. And let it go. You can shake it out, maybe take a palm tree if that's feeling good to you. Cleansing breath. And then you guessed it, we're going in now for 75% through the big toe mound or toe knuckle, rooting it down at 75% energy. And then 25% out of the outer heel. Breathe. Notice how that feels, how that translates, or the energy moves in the pelvis, the legs, maybe even your upper body is feeling it. Good, and then let it go. Take a release, maybe cleansing breath. So those are two ways that you can work with your Pada Bandha. If you found that one of them worked really well, you felt like really balanced, like you had a nice root through toe mounds, through the circle of the heel, toe pads felt connected to the earth, yet the inner arches of the feet are lifted. So there's that oppositions of force, rooting down with a rebound of the inner arches lifting up. Maybe one percentage worked out best for you, so just bring that into your practice, into your day, as to how you want to support your body. Your feet are your foundation for how your body will move in space, okay? So another way to do Pada Bandha is thinking of an X, okay? So you can think of rooting down through the big toe mound, and then as if there's a line, sending energy across the foot to the outer ankle. And then rooting down through the pinky toe mound, as if there's a line now, sending energy across the foot to the inner ankle. So they're rooting down, so there's energy going down, yet there's also energy going across the foot in an X. A few breaths to play with that one. Remember to ease off. The magic happens when we find ease. Remember to breathe. So that is the Pada Bandha lock or foot lock of an X across the foot. So maybe that felt more supportive to you than the other two. So you get to decide how you want to set your foundation for your day. Take 5 minutes in the morning just to think about how the feet are connecting to the earth, how that translates through the legs into the pelvis. And at first, if you're someone who has a lot of natural space in the front of the pelvis or in the back of the pelvis, this is going to feel uncomfortable. It's probably going to feel so different that there'll be some discomfort. So just remember to offer yourself grace and compassion. And maybe at first we just start with a little bit of effort, right? So if you're at, say, a 45-degree angle in the feet naturally, just bringing them in to maybe a 30 to start, right? And then making your way over time to have them in line so that the toes are pointing forward, the outer edge of the foot is in line with something parallel, like your mat. And most important is the breath. When we stop breathing, the body goes into stress, and so whatever you're doing is no longer beneficial, okay? So it's really important to keep a nice smooth and easeful breath. Sometimes we just want to release, and that's when we use a cleansing breath, in through the nose, out of the mouth. So that is your foot to pelvis connection. Noticing what's happening in the feet, setting a pada bandha or a foot lock, and then noticing how that translates into the pelvis. If this is causing you some sensation, some kind of extra sensation because of the shift, then we can bring in different things to help the fascia hydrate faster. And so to do this, you can see some of my other videos. The foot rolling video is a really good one. I offer different balls to help hydrate the fascia. So you can actually use these balls as well as forms of massage through the hips. So you want to think your fascia, this kind of interwebbing of connective tissue, is meant to be super wet and slide and glide. And so if your body's been moving in a certain way for a long time, it can get adhesions or dry in certain areas because of that different alignment. When we start to shift it, we'll feel pulling. We might feel discomfort. And so to support ourselves, we can bring in some nice gentle massage. You might go to a masseuse, it's the same idea. But I use a squash ball, and you want to think of your fascia receiving the ball. Might sound a little strange, but you don't want to just press the ball into the flesh and just kind of dig it in there. You want to allow the fascia to be calm, to feel safe. Your fascia is connected to your nervous system, and it has receptors on it that are constantly receiving and sending signals to the rest of the body about how safe your environment is. So when we are in stress, or if we try to really push into something, the fascia receives that as not being safe. And so it hardens and it goes against what we're trying to do. So instead, finding the breath, a nice deep diaphragmatic breath, will help the body send messages of safety. Noticing your thoughts. If your thoughts are negative or fearful, your body doesn't know the difference. Your brain doesn't know the difference, as if it's really happening or if it's just a thought. So really noticing your thoughts and choosing to think positive thoughts. So you can massage with the squash ball anywhere that your hand will reach. You can use the foot rolling video that I have for free as well on my YouTube channel. You can use these spiky balls as well as the wooden dowel. So the wooden dowel you'll see on the foot rolling video, we also roll our feet out with that. And another way to hydrate fascia is tapping. So a gentle tapping wherever the body feels fleshy, wherever there's flesh and fascia. We want to avoid the bones. You could use a wooden spoon at home. You can actually even use your hand or tented fingertips, a cupped hand. And listening to your body. If it's saying, don't tap there, that doesn't feel good, listen to that and move around it. If it's saying, keep tapping there, that feels awesome, keep tapping. Linger in that spot for longer. And the same with the tapping as with the ball, we want the fascia to receive the vibration. So the tap causes a vibration on the outer layer of skin, and the vibration energy moves all the way through the outer layer of skin to the bone. So you can think of the fascia from the outer layer of skin through the muscle, it's intertwined all the way through to the deepest levels of your bones, of your cells. So you can tap your whole body with a dowel or with your fingers. You want your flesh to be jiggly. You don't want it to be tight. Obviously, the fascia won't receive the vibration if it's tight. And then another way to do this, if standing is feeling a little bit too stressful, the body can't find ease, is to come onto the ground or even onto your bed or seated. Making your way onto the ground in the safest way you know how. If that's not in your practice right now, then of course just making your way onto a couch, a bed. Once you arrive, take a few deep breaths. Just kind of releasing or surrendering your body into the support beneath you. Sometimes you might want to lift the head and neck a little bit. We want the chin to feel like it can be in alignment with the heart. If it's way up here, we're also opening the front of the neck. That can trigger our stress response. So we want to keep the head and neck in alignment so that it's an extension of the spine. So I could have a little block under here for my head. I'm just going to put my arm under there for now. So even when we're laying down, you can now check in with your foot to pelvis connection. So you might take a look. If your feet are bent or your knees are bent and your feet are flat on the bed, couch, floor, just check in with the outer edge of your foot and line it up as if it's parallel with the outer edge of a mat. Notice how that feels. It might feel awkward or different. And then rooting your pada bandha, your foot locks. So toe pads, noticing them on the earth. Toe mounds. Circle of the heel. Inner arches, are they lifting in a opposition of force to the grounding of the toes and the heel? Good. So now you've noticed your foot connection. Keep awareness there. So often when people are practicing with me, I'll notice their feet kind of pop up when they're practicing. Their toes might pop up. And so I bring cues in to bring more awareness to that place or checkpoint of rooting, of foundation. And then that translates through the legs all the way into the pelvis. So now noticing the pelvis, the back of your pelvis. Letting it become heavy and rooted into the earth. Taking deep breaths, inviting the pelvis to let go or to surrender. Allowing your muscles to release, to soften. And you might just breathe here with each inhale, thinking I'm receiving the breath. I breathe in to receive. Each exhale, thinking I let go or I surrender. I breathe in to receive. I breathe out to let go. One more. I breathe in to receive. I breathe out to let go. Good. So you might have noticed a little sensation through the pelvis, through the inner thighs, or the hip flexors. We're going to work today with the spiky balls. So what we're going to do is, this is another way to massage. If your fascia is feeling tight from the adjustments of the feet, we can bring these massage balls into our practice and just laying them underneath the fleshy parts of the body. So you can see kind of my glute muscles here, they're fleshier, and that's where we can release the fascia without feeling that the body is going into stress. And maybe some days it might feel like this muscle is so tight that even putting a ball there, it does feel like it's going into stress. And if that's the case, just take this one out. Wait until a day when you feel that the muscle has softened. In the meantime, you can do the tapping practice and the foot rolling practice to help hydrate the fascia. And so what this does, the vibration and the foot rolling sends signals all the way through your fascial lines to hydrate. And so we have to drink enough water, of course, as well. But we want it to be sliding and gliding. And just by foot rolling, just by tapping, we can help it become more hydrated. So if you're using the massage balls, you can place them there and breathe a nice deep breath. I breathe in to receive. I breathe out to let go. You might just find stillness here, and that feels like enough of a release. Remember, 70% or less effort. There's no need to push, especially when we're dealing with pain. If you have an injury, then start at 30% effort or less until that injury feels like it's dissipating and you feel safer to move to 50% effort or less. You might flow with your breath and the prop, the massage ball. So maybe I inhale to receive, legs move to the right. I exhale to let go, legs move to the left. Slow it down. Ease off. Do less. So you can play with this as long as it feels comfortable for you, switching sides. Another way to play with the ball or two balls is to prop them both under the pelvis. And now if you have like pretty painful low back issues, I wouldn't suggest doing that one right off the bat. I would wait for some time to really work with the fascia on the outer hips first. But if you're not dealing with that, you could prop the pelvis up onto the ball and then release the pelvis onto the ball. Again, we need to think of this sense of safety, this sense of feeling safe. If you don't feel safe, if you're getting kind of, ow, like little signs from the body that it's too much, then ease off. Don't go there. We can play with the leg that the ball is under, so you can send that leg up towards the sky, especially if you're okay to be in inversions. If you're not okay to be inverted, so inverted means my head is below my heart, and now the blood is flowing in the opposite direction towards the head. So people who suffer stroke, we don't want to, it's contraindicated to invert them. Low blood pressure could be another one. Then if you're okay here, you might take little circles with the whole leg. And you want to think of letting the leg bone sink into the hip socket. So softening, letting go. And then sending energy out of the tips of the toes and out of the heel as if you're standing. And you can take a generous bend through the knee as well and play with that. So no need to kind of point the leg and really activate the muscles here. We're doing the opposite. We want to soften so the fascia can release. Maybe some figure eights or figure four, taking the ankle up over, crossing it over the opposite knee. Rocking here. So these are all ways to support releasing the fascia of the pelvis. Foot rolling to release the fascia of the feet. So that's taking the ball into the bottom of the foot and then rolling it out. So you can do this from lying down, you can do it from seated, you can do it from standing. And again, if you're not familiar with this practice, go to my foot rolling video to learn how to do it in the most optimized way for your body, to really absorb the work that you're doing. And then you would repeat on the other side. So these are beautiful ways to support our foot to pelvis connection. And then once we have that awareness, we can really start to bring that throughout our day. And then we can start to see the translation from our foundation into our upper body. So stay tuned for another video where I will go into how that then translates through the rest of the upper body as well. Thank you for joining me. I wanted to mention the toe spacers one more time. You can get those on Amazon. You can find them through different yoga prop companies. If you have kind of bigger, wider toes, these ones wrap around the toe, and I've had clients that didn't really like them because they cut off the circulation. So you might want something that just goes in between the toes. I think they're called Joya toes. Those ones are just in between the toes, if I remember right. And this can be a really great tool to help you connect to the toe mounds and to the toe pads. You think about the feet and how we crush them into shoes throughout our day. And really in history, we didn't have shoes way back in the day. And so our feet were really our foundation, and they were meant to spread out. They were meant to utilize every aspect of the connective tissue, of the fascia, of the support that our feet offer us. So if you have any questions or comments, please leave it below. Remember to share this video with anyone else that you think would benefit from this foot to pelvis connection. And don't forget to subscribe and like the video as well.